The first thing is, can you give me a history of your problem, your neck problem?
Sure. So basically, I'm a dentist, recent graduate. I've been out for about a year and a half from dental school, and really bending over, not having proper posture all the time, even though I know what I should do. I don't always do it. And when I ended up working in the same practice as Devin works at, I had my lower back actually start to really hurt, almost like a sciatica into my leg. Had to go to the doctor, got an x-ray taken, found out that I have a 6th lumbar vertebrae, that I should be exercising more, surprise, surprise, and that I needed to go to physical therapy. Started into physical therapy. It was helping. And then Devin offered to let me use the Archlifter, and now I am waiting for production so I can buy one.
So, so you had a little bit of scoliosis, right?
Yeah.
You found out?
Yeah.
Okay. About how tall are you in centimeters?
I trying to remember in centimeters now. I'm 6'1".
So you're about 184. That's
something
about
around that,
184
yeah.
centimeters. So, and with the scoliosis, you showed me an MRI, I believe, or
no, it was a film.
That's right.
It was a film. So it had a little bit of scoliosis, and you could see the vertebrae were a little bit.
Yeah.
Yeah.
So you would probably be a few centimeters taller if it weren't for the scoliosis.
Probably.
And yeah. And so, did you have any symptoms from the scoliosis?
The only symptoms that I didn't have any symptoms up until I basically started to work with you. But the before, I wasn't really having much issue. But it was a lower back ache, and it was in my buttocks, and then I could feel it running down into my leg, into my knee.
So it was
it was pain. It was a nerve pain.
Yeah, so it was like sciatica, basically.
It was like sciatica.
Yeah. Now, you also had some neck problems, as I understand, right? You had a little bit of forward.
Well, I have forward end posture. I can't really say that it's caused me a lot of problems, but after using the Archlifter and being able to actually, I don't think I ever knew how to stand up straight until after I was using it. Yeah. And when I started using it, realizing what posture I'm supposed to have, I can recognize now issues. Yeah. How long have I been without it? When did you take it? About a week ago?
About a week ago, I took it. I took it to Great Britain. So
right. And when I'm working on the computer and sitting on the couch, and I'm starting to feel more in my upper back, and neck, that I'm stressing it.
Yeah. Okay.
But it's a combination of here, plus it's only a week later, and like I told you earlier, as soon as I gave it back to you, I started doing my physical therapy stretches again, anticipating that I needed to do something. Yeah. And I'm starting to see the symptoms come back.
Okay. So you had you were really unaware of your issues.
For the most part, yes.
For the most part, you were unaware. Then you had some sciatica.
Right.
Once you started working here, and you've been in science before. And then you went to dental school. You were in your late 20s when you went to dental school? Yeah. Yeah.
Correct.
Then and then you finished, and now you're about mid-30s right now. Right? Okay. And so this is kind of this is your first real practice in dentistry.
Right.
And kabam,
I got hit.
You got hit. Right. I understand. I know exactly what happens with that. So, because it's that leaning down, and then when the patients just come, they come again every day, patient after patient after patient, and it doesn't stop.
Right.
And your back and your neck really take a hit from that.
Right.
And so I completely understand. So, as somebody who who has so basically with a lot of life and a lot of professions, it seems like you really have to lean forward. You lean into your job. I mean, really. I mean, even in science, you had to do that. But But in dentistry and in school for years before that, you were leaning into your books, right?
Well, even now, when I'm not playing with the kids, I don't do this. But you take the cell phone. Yeah. And you're like this. You're on the train. You're like this. You're looking down. You're having head forward posture.
Yeah.
And it's just.
Yeah.
It's not good.
It's not good. Yeah. The human body wasn't designed for that. It was designed to hold your head up above, like I always say it's like a bowling ball on top of a column. Mm-hmm. That's how the body was designed. So so you had the Archlifter. So you took the Archlifter and you had the version that pushes on the teeth, right?
Correct.
And it was pretty stable. You were pretty stable. How long did it take you to learn how to use it?
2 sessions. The first time, so at the beginning, you let me just have it. Basically, no instructions. Almost like see what you're going to do with it. And by the time I figured out how and what I was doing, I put way too much time and effort into it, so that my upper teeth were a little bit sore, and then I probably overstretched my neck the first time. Yeah. So I realized that you have to reduce it down at the beginning. It's like it's like anything that you're starting for the first time. Denture wearers need to start eating slowly. Kids going into braces need to eat soft foods. Same thing with this. I just needed to slow it down. Do a minute a day. Right. But it took about, after the first 2 sessions, I kind of made a goal of a minute to a minute and a half. If it was a good session, I'd go a little bit longer. Occasionally, since it was pushing against my teeth, I already know that there's nothing really going on there, but I was feeling a little bit of sinus pressure, and nothing that was really wanting me to stop using it. It was good. Okay.
And so you're tall and you're a big fellow. You weigh close to 100 kilos. Is that right? Okay. What percentage of your body weight would you say that that was most useful for you? And maybe you could convert that to kilos for us, and then maybe pounds.
Right.
You figure pounds.
So
I haven't thought about pounds.
I haven't thought about pounds for a while either. So I'd have to say that I've been able to get up to about 80 kilos of weight. Of weight. Okay. On there, I can't do 100%. And
nor should you. I mean, there's really
there's no need. But basically, I got to the point where I'm able to hold on and lift my feet up, and I know that I'm not having to hold that strongly to hold myself up. And at the beginning, all I had to do is relax, and it takes a little bit to get used to doing that. But once you stretch out, it really basically almost starts to come more naturally as you use it.
You basically, I think what you do is you learn to relax and let the traction do its job.
Because you want to fight it.
When you first, I understand. I know that. I know that one. So I kind of remember that. I've been doing this for some years now. So I'm pretty much a pro, but I wanted to hear from a real newbie, somebody who's just started using the Archlifter. So how long would you say you used the Archlifter?
It was about a month.
Okay. It was about a month,
And it's about a month.
Okay.
And I used it almost every day. I had a couple vacations that I didn't want to pack it with me, but
it is a kind of a heavy beast, isn't it? It's pretty solid.
It's not heavy. It's just it's just bigger.
It takes
and with the kids and packing everything in the car, bringing it on the train, I chose not to do it, but I kind of regretted it too. You go in a 5-hour car ride, and you're ready to use it when you get there.
I understand. Especially if you sit in the back, right?
Right.
Right. Okay. So do you have any advice for anyone who has scoliosis, lower back problems, neck problems, people who hunched over, what would you tell them about the Archlifter in their experience?
I'd say try it. And truthfully, these kind of things I look with a skeptical eye when I first look at it.
Yeah.
And in this case, I went, sure, I'll try it. And now I am a believer in it. I think it helped me.
Yeah.
And I would say to anyone, try it, and I think you'll see it, and I think you'll see a difference. And because of that difference, you'll most likely want to continue to use it.
Okay, great. That's great. Okay, thank you very much for that information. And may I use your name? May I say
Yeah,
Dr. Drew Ferrell? Thank you very much.
Not a problem.
Okay, great.
Yep, thanks.
Okay, have a good day. Okay, good. That was easy.
That was.
Yeah. And would you like to, would you mind if we do a couple of demonstrations?
No, I don't. Yeah.
Downstairs?
Please, I want to use it.
Yeah, sure. Yeah. Okay, so he's unpacking the Archlifter, and he's got a 1-ton strap that he's using.
So basically, I like to put it around the stairs. I just basically found a place where something that could hold my weight, that I wasn't really worried about it breaking.
Yeah.
So if you have a pull-up bar or something like that, you can put it in a door frame. But now we're almost set up.
Yeah.
Now, usually put it into a plastic bag just to, because we're dentists and we're anal retentive and
Yeah, right.
bacteria and whatnot.
Yeah. Yeah, it's hygienic, right?
Yeah.
Now you might want to check the neck strap because people were using it over the weekend and
It's overly tight.
it's overly tightened. Yeah. We had some smaller ladies using it.
Ah, okay. Yeah, it felt a little tight back there.
Okay, so he's placing the mouthpiece in his mouth and in the holder, and he's grabbing the Archlifter, and now he's starting to bend his knees to add some weight to the Archlifter. And by doing so, he's starting to traction his back and his neck, his entire spine, actually. You can see that the Archlifter is tractioning his entire spine. Okay, so he's adjusting his feet to adjust the angle of traction. And you can see he lifts up on his feet to give his lower back some traction, extension and flexion to get those discs stretched out, open up the disc spaces. It sucks the contents of the discs back in if he's got any bulges, and it hydrates the disc in general. Okay, and he's doing an extension. He's extending his back. This is similar to the physical therapy stretches, and he's doing a flexion stretch, basically helping to get his spine all stretched out. Okay, and then he's also doing this stretch. This is the lower back stretch, I call it. Okay, now he's modifying his legs a little bit, bending his knees, and getting some good traction on his entire spine. And it's been about 4 minutes altogether.
It's a little bit longer than I usually do, but it's also been a week since I used it.
Yeah, right. So can you give us an idea of what you were doing there?
Yeah, so basically, at the beginning, I was just trying to get relaxed enough that I could allow myself to have the traction go through, because even though I'm holding, it puts a lot of tension on my upper back muscles, so I'm not really relaxed as much as I want to be.
Mm-hmm.
So I need to just kind of get relaxed.
Yeah.
And then once I get into a more relaxed state, I can hold on to it. And then one of my favorite stretches is basically lifting my legs up and going forward and back, getting those discs to really open and close. And then doing those other stretches, just kind of overall, I'm focusing more on my lower back than my upper back. When I'm just releasing without my hands up, I'm looking more to relax my upper neck. I was working today, and I don't know if you had the camera on, but I kept on doing this. But I'm already feeling better just from using it for that 4 minutes you said it was?
It's about 4 minutes.
Yeah. I guess I don't even know how long I'm using it. It's kind of becomes a nice relaxing moment.
Yeah. So is like 1 to 4 minutes, is that typical? Would you
Yeah, I wouldn't really do much more than that.
Yeah, there's probably no need.
Probably not.
Yeah.
And I already feel like, I don't know, I wasn't thinking about it, but I already feel like I'm standing up more upright than I was before.
Yeah, maybe,
so
yeah.
a little bit,
Right.
yeah. So it's, that's what I was doing.
Yeah. Have your kids, do your family members notice any difference?
Yeah, my wife will, on the days that I hadn't done it yet, or I did it in the morning and then I waited until the evening the next day, my wife would say, "Hey, you haven't used that yet." And I go, "Yeah, you're right, I haven't."
Yeah.
I was surprised she actually noticed. Yeah.
So I think someday people are going to be asking, have you arch lifted today?
Could be.
So, yeah, I don't know. Anyway, okay.
You need to coin that.
Yeah, right. Right.
You just did, so
Yeah.
all good.
Yeah, okay. All right, thank you very much, Dr. Ferrell.
Yep, not a problem.
Okay, so we're going to sign off.
Sure.